Hello, I'm Jackie Mueller, an RN at the Headache Care Center in Springfield, Missouri. The video you are about to see is an effort to explain what migraine is, why it hurts so much, and a little bit about how we can most effectively treat it. People get migraine because they are born with a genetically sensitive nervous system, a nervous system that is more vigilant, more aware of, and more impacted by changes. This sensitivity to change is why people believe and have found that certain triggers can cause migraine. They know, for example, that changes in weather or alcohol or exposure to bright lights, glare, changes in their sleep or stress pattern, or for women, the hormonal changes of menses, all can put them at risk for migraine. This sensitive nervous system, when subjected to these changes, starts to undergo a host of chemical changes inside the brain itself. This can often lead to symptoms that are a person's first awareness that migraine is on the way. These are called premonitory symptoms, or are more commonly referred to as prodrome. There are changes in mood, perhaps blurred vision, lights may become brighter or sounds become louder. There's fatigue, sometimes thinking is slow. In addition, there are food cravings, especially for simple carbohydrates, and that may be one of the reasons we often think of chocolate as a trigger of migraine. Other important premonitory or prodromal symptoms are pain in the muscles of the head and neck. These painful muscles were misidentified as muscle tension and considered symptomatic of tension headaches. In addition, there may be nasal stuffiness, facial pressure or pain, or nasal discharge, which may seem to be related to sinus problems. Other common symptoms include yawning, fluid retention, or other events that tell a person a headache is on its way. If these changes continue and are not stopped during the prodromal period, they can reach a point where they activate centers deep inside the brain that actually advance the process of migraine. This has been termed the migraine generator, though some people think it is more a modulator of the processing of sensory information coming into the brain. That is, information that is telling you about how your body feels. This activation of the migraine generator leads to a wave of electrical instability in the brain, a wave of electrical activity that is organized and moves slowly across the surface of the brain. If certain nerve cells get caught in this wave of electrical activity, this can give rise to the visual phenomenon called aura. An aura may be flashing lights within the visual field. Sometimes an aura can be tingling or numbness, particularly in the face or hands. Most people do not have auras. It's estimated that only about 15% of migraine attacks are preceded by an aura. Most commonly, auras will stop before the onset of headache pain, though some people have auras that return during the headache itself. This wave of electrical activity can also activate the nerves and blood vessels on the surface of the brain and may be a mechanism by which migraine progresses. All of this activity can occur before the actual onset of headache. To understand where the pain of migraine comes from, we need to understand the nerves which conduct pain in the head, face, and neck area. The major nerve that does this is the trigeminal nerve. This nerve has 3 divisions or branches. The first branch, the ophthalmic branch, goes to the forehead and perhaps most importantly in migraines, to the blood vessels and surfaces that surround the brain itself. The second branch is called the maxillary branch. This goes to the middle part of the face and very importantly inside the sinus cavities. The third branch is called the mandibular branch. This goes to the lower jaws and the muscles you chew with, including the temple muscles on the side of the head. All 3 of these branches can contribute to the symptoms of migraine. During migraine, the first division becomes activated and releases a series of chemicals that cause the blood vessels in and around the brain to swell and become inflamed. The threshold for information to be sent along the divisions of the trigeminal nerve is lowered. When the blood vessels are inflamed and the head is moved or a blood vessel is stretched, The beating of the heart will activate and send a volley of pain information along the trigeminal nerve tracts and into the brain itself. This relay station in the lower part of the brain normally blocks out much of the extraneous information. However, during an attack of migraine, this filtering ability is impaired and more information is allowed to get through the filter and into our conscious awareness. As I said a minute ago, all three of the branches of the trigeminal nerve can contribute to the symptoms we see during migraine. If there is an activation of the blood vessels and nerves of the second branch of the trigeminal nerve, the tissues of the sinuses can swell and other nerves can be activated that cause a clear discharge. This commonly leads people to believe they are having sinus headache or a sinus problem when in fact it is part of migraine. The third important source of information is from the muscles. This can come from the third division of the trigeminal nerve, or more commonly from muscles in the back of the neck or in the back of the head to the muscles of the neck and the shoulder area. This information too goes into the filtering system in the base of the brain, and here it is integrated with input from the three branches of the trigeminal nerve.